I am Dr. Karen Power with PowerMD, and I'm going to demonstrate today a filler injection into the cheeks using a different product called Radiesse. The filler products that are used for injection underneath the skin in order to add volume are typically a hyaluronic acid base, and that's a complex, naturally occurring substance that is found in the skin and gives it a little plumpness. This particular product I'll be using today, Radiesse, is a hyaluronic acid that also has inside of it a small crystal, hydroxyapatite crystal. And that extra calcium crystal gives it a little bit more staying power and quite a bit of lift. So Radiesse product here, it's a white color rather than the clear color that most hyaluronic acids are known for. And the first thing I'm going to do is I'm going to mix a little bit of lidocaine into this product, and that will help during the injection in order to anesthetize the area and make the procedure a little more comfortable. So we'll start off by drawing a little bit of lidocaine. I like to use 2% if I'm doing any sort of filler where I want quite a bit of lift and I don't want the dilution. So 2% lidocaine, and I'm only going to use a half of a cc, that's a half of a milliliter. And by adding this lidocaine, makes the procedure very well tolerated. Sort of numbs the area as you're doing the procedure, so you don't need to do injections with the numbing agent prior to the procedure. It just is all done at once. So we connect these two syringes and we mix the lidocaine in with the product. Just mix it up. So our model patient today just wants a little more lift on the cheeks. We've already started with a straight hyaluronic acid a few weeks ago, and that gave a little bit of plumpness, but she wants a little bit more lift. And the calcium crystal found in this product will help with that. Typically the cheeks flatten for two reasons. The first reason is that there's bone loss, particularly right here where there's a foramen or an opening in the bone structure underneath where the vessels and the nerve come through the bone. And that foramen is an area where we get some early bone loss and flattening of the cheek. Additionally, there's a second process, and that's some fat loss, and that fat loss will also flatten the cheeks. Then sometimes there's a little bit of gravity that will drop the fat pad on the cheek a little bit lower, and so you lose the nice round curve of the cheek. Our model patient here is pretty young, so gravity is not the issue. There's more a little bit of fat loss when the baby fat from the cheeks thins a little bit as the face matures. So I've mixed the product here so the lidocaine is distributed through the product. And I like to take about half into the original syringe. Leave that for the second cheek. So I'll take about half, work on one cheek, and then use the second half for the other cheek. So her skin's already been prepped, it was cleaned. And then a topical lidocaine or a skin cream containing lidocaine and also benzocaine and tetracaine was applied to the skin, and that will numb up the skin a bit. And in her case, it actually causes her cheeks to get a little pink too. You can see the alcohol does the same thing. So there's a little lidocaine on the surface of the skin to numb it up, and then there's some lidocaine also in the product now so that we'll continue to get a little bit of numbness as we move forward. All right. So again, I did, just a few weeks ago, put in a hyaluronic acid called Perlane, and that gives nice round plumpness to the cheeks. But now I'm going to go underneath again with the calcium crystal, and I'm going to build up a little bit along the bone line, and that's going to push the product forward and give her a better curve, a little bit more sort of three-dimension. And if you look from the side, you can see the flatness and the flatness here. Sorry, I don't know if you can see that there. Now give a little bit of a smile and you can see the cheek push up. And that nice round curve is what we're looking for. So when she's not smiling, you just want that little bit of a gentle curve. Right. Okay, are you ready? Mm-hmm. Okay. So this is a very quick procedure. So first, we will look to see where that little foramen is, where those vessels come forward. It's pretty high and central here, so we're going to move right down here with the product. There is some bruising risk with this procedure, primarily because you do come close to those vessels. the bruises will resolve. A little pinch, a little support with my fingertip here, a little pinch. So then we add a little bit of product as we go along. All right, good, you're doing okay?
Mm-hmm.
And the lidocaine that we mixed in will help make the cheek nice and numb so that we can go back in the area if we need to, and also so that it should be more comfortable when we're finished. So as you can see, she gets pretty red, just very sensitive skin. But also you can see the lift that's occurring immediately. Add a little bit of pressure. So we'll keep going, go back and forth, looking at both sides, make sure that we have a nice even result. It's also important to look from above. Sometimes that's a really good way to visualize the flatness that occurs as you lose a little cheek volume. Okay. Now I did not put any epinephrine into the lidocaine, so sometimes you'll see a little bit of oozing. All right, good. Okay, so start seeing a little bit of curvature already. You doing okay?
Mm-hmm.
Good. So when she smiles, you can really see that little pop that comes up from the cheek, and it's nice and round without the little groove in the shadow that you can see on the other side. A little bit more here. Okay. Little poke. Try to do not too many injection areas. Not too many times through the skin, because that is where you get the discomfort. All right. Now when there's a little bit of oozing, you do want to add some pressure to try to minimize the bruising. This product is a little bit less moldable than the products without the calcium, and so that enables you to put some pressure. You don't want to overdo the pressure though, or you can actually mold the product and flatten it when really what you're trying to get is lift from the product. Okay, mix up the product a little bit more again, refill this syringe, and then we'll go into the other cheek. And walk around to the other side. So because of the calcium hydroxyapatite crystal inside the product, there's really excellent stimulation of collagen synthesis. And in fact, by going close to the periosteum or the bone, you can actually stimulate a little bit of bone growth as well. So although the product only lasts a year or so, the extra collagen, little poke here, and even extra bone structure that the patient will grow will give a lasting result. So after a few procedures, you can really get some good changes, and the patient will not need as much product on subsequent visits. One thing to warn the patient about is the possibility of this showing up on an x-ray because of that calcium. Occasionally dental x-rays, you will actually be able to see the product as a small haze. Okay. How are you feeling?
Good.
Okay.
That lidocaine makes it all numb.
Okay, good. Numb and pink, and you're okay. So our cheeks look very rosy. That's just a sensitivity reaction in this patient. A little poke over here. This is a great product, gives excellent lift, whereas the regular straight hyaluronic acids have a really nice feel to them. So I love to layer the two. So going a little bit deeper towards the bone with the product that contains the calcium, and then overlying it with the product that is just nice and moldable in order to give that nice sort of full squishy top to the cheek. I can actually feel the product that we applied a couple weeks ago. And together the two layered will give a nice lasting result and a nice natural finish. All right. So again, it's very important to look at different angles to make sure that the curve looks smooth and regular. And looking down from the top is an excellent way for the injector to sort of see where there might still be a deficit, which I see right here. One more poke. You doing okay?
Mm-hmm.
Oftentimes people need a little bit more product on one side versus another. And she started off with a little bit of asymmetry, but when I used the Perlane hyaluronic acid on her prior treatment, we did correct for most of that asymmetry. So this time I'm just giving a little bit more bone structure, a little bit of a stronger cheekbone line, especially right here. Okay. All right, so when the redness goes down, it's going to have a really nice natural look, and the cheeks have a little bit more roundness. Give it a little smile, and we're finished.